We're going to talk about the treatment for the BPPV. In case of anterior canal and posterior canal BPPV, we are trying to dislodge the crystals or otoconia from the ampulla side towards the utricle side. We are moving from one spot to another spot by the direction of the gravity. For example, if the patient has a posterior canal BPPV, this is the ampulla side and this is the utricle side. When we move the crystals or otoconia from here to all the way down and put it back to dislodge the otoconia. In order to do that, we need to move the body in a certain way towards the gravity. For example, this is the posterior canal, the crystals are here. We're turning the head 45 degrees and then putting the patient back to supine. So because the gravity assistance, the crystals are moving from top to bottom. And then we are making the patient to move to the opposite direction by keeping extension so that we can move the crystals back to the other side of the canal, which is towards the utricle. We're going to do the treatment for the BPPV. This treatment is called canal repositioning technique, or commonly called Epley maneuver. This is for the anterior canal and posterior canal. Keep the patient closer. Make sure that you have enough space so that the head can hang down. Number one position is going to be turn the head 45 degrees of the side of the treatment you're going to treat. Bring the patient back supine as fast as you can and then extend the neck. Maintain this position. The extension normally about 30 degrees of neck extension. Maintain this position until the nystagmus stops. After the nystagmus stops, wait for approximately 20 to 30 minutes. 20 to 30 seconds. Once the nystagmus subsides, carefully move the head to the opposite side and then carefully maintaining the neck extension 45 degrees to the opposite side. Stay in this position. If you see a nystagmus, wait until the nystagmus is gone and wait for about 20 to 30 seconds. Position number 2. Now the position number 3 is, if the patient is able to turn to the left side by himself, if not, get some help to turn the body to the left side. After you're turning the body to the left side, carefully rotate the neck all the way up to 180 degrees and then tuck your chin. Neck should be flexed. This is the position number 3. Maintain this position until the symptoms subside and for about 20 to 30 seconds. After this is complete, carefully keep the chin tucked and then assist the patient to come back to the sitting position. When the patient is come back to the sitting, he can bring back the neck to the normal. This completes the one round of the Epley maneuver. You do the treatment on the right side. If the right side is involved, you do the treatment to the left side is involved. This test is effective in case of canalithiasis. If the debris is floating freely in the canal, this technique is effective. You can retest after completing the treatment. If the treatment is not effective, you can repeat the treatment again one more time. This Epley maneuver canal repositioning technique is advisable for canalithiasis for both anterior canal and posterior canal. Thank you.